Thank you for your introduction. I am happy to have this opportunity to speak to you today. I'm Hidemichi Fukuda, a medical doctor and specialize in sleep disorders and dementia and have treated these patients for over 35 years in Japan. Today, I will be presenting a talk titled Evaluation of Effectiveness of Treatment of Sleep Disorders and Dementia by AiSleep. Sleep disturbances in patients with dementia in medical and nursing care facilities not only impose a tremendous burden on caregivers, but also cause patients to leave their beds during the night, often leading to accidents such as bone fractures from falls. Although it is important to objectively evaluate such sleep disorders, polysomnography (PSG), the golden standard for sleep evaluation, is difficult to apply electrodes, and even the simpler actigraphy is difficult to apply continuously to dementia patients with severe BPSD. Tools are needed to objectively and quantitatively evaluate sleep disturbances in dementia and, in addition, to enable differential diagnosis of sleep disturbances. AiSleep measures pressure changes from an air mat placed under the bedding using a microphone element. The measured signals are separated into cardiac pulsation wave component signals, respiration component signals, and body movement component signals using a band-pass filter, and can be used to determine the sleep stage and identify bed rest behavior using DFA, the trended fluctuation analysis. AiSleep consists of a sensor mat section that senses pressure and a device that digitally converts that pressure. A mobile battery can be used as the power source so that dementia patients do not disconnect from the power outlet. The mobile battery and device can be hidden in the mattress and will not be touched by the patient. Next, we discuss sleep evaluation. This is the result of my 24-hour sleep analysis. The upper row shows heart rate and respiration rate, and the lower row shows sleep stages. The dark red indicates waking, yellow indicates wakefulness, pink indicates REM sleep, light blue indicates light sleep, and dark blue indicates deep sleep. 21:30 is when I entered the bed. I was awake for a while, then fell asleep, had deep sleep in the first half of sleep, and had REM sleep after deep sleep, which seems to represent a somewhat normal sleep result pattern. The dark red areas shown here twice are awakenings for urination. I will now present case studies. This is an 87-years-old male with Alzheimer's disease displaying his sleep-wake pattern for 1 month. On the left is a 24-hour sleep-wake assessment of insomnia from the time of admission to 1 month. On the right is the evaluation when sleep improved after changing under risperidone 1.5 mg and quetiapine tablets 12.5 mg to quetiapine 62.5 mg. Looking at the left side, onset of sleep was slow and also very unstable with multiple awakenings and sometimes very poor sleep. With the drug change, the patient falls asleep within about an hour of getting into bed, and then has relatively stable sleep with no awakenings or stand up from bed. This slide represents the changes in sleep variables. Compared to insomnia, sleep onset latency was significantly shorter and REM latency was significantly shorter during sleep improvement. Light sleep time and REM sleep time were significantly increased, and stand-up time and stand-up frequency were significantly decreased. This slide represents the changes in vital parameters. Compared to insomnia, the mean heart rate during nighttime awakening and nighttime sleep significantly decreased during sleep improvement, and the mean respiratory rate during nighttime awakening also significantly decreased. The number of snoring was also significantly decreased. Considering that the respiratory disturbance index did not change much, it is possible that the subjects were detecting the monologue as snoring. This is a case of Alzheimer's disease in a 95-year-old woman. Insomnia is marked by daytime somnolence and frequent nocturnal awakenings. Administration of risperidone 0.5 mg has resulted in a decrease in nocturnal awakenings and a marked improvement in daytime somnolence. This is a case of Alzheimer's disease in a 94-year-old woman. She falls asleep just fine, but early morning awakenings are noticeable. She has changed from quetiapine tablets 25 mg and 1 lemborexant 5 mg to quetiapine tablets 37.5 mg and mianserin 5 mg, and the early morning awakenings have improved. This is a 90-year-old woman with Alzheimer's disease. She has difficulty falling asleep, awakening of nighttime sleep, and sometimes somnolence during the day. After administration of 12.5 mg quetiapine tablets, there was improvement in difficulty falling asleep, awakening during the night, and somnolence during the day. This is a case of Alzheimer's disease in a 94-year-old woman. She has difficulty falling asleep, awakening in the middle of the night, and sometimes early morning awakening. After adding mianserin 20 mg and quetiapine 25 mg, improvement in difficulty falling asleep, mid-morning and early morning awakenings were observed. In the 5 cases, significant changes in sleep variables are shown in the table. No sleep variable showed a significant change in all 5 cases, but there was a significant decrease in stand-up time from bed in 3 cases. In vital variables, mean heart rate during nighttime awakening was significantly increased in 4 cases. In all 5 cases, the mean respiratory rate during nighttime awakening was significantly decreased. 1. AiSleep, a non-wearable IoT, is suitable for objective assessment of sleep in dementia and may be used to determine the efficacy of pharmacological and non-pharmacological treatments for sleep disorders in dementia. 2. It has potential as a tool for differential diagnosis of sleep disorders in dementia. At present, it is possible to differentiate sleep-wake schedule disorder and sleep apnea. In the future, we hope to use the autonomic index to diagnose night delirium and detect REM behavioral disorder. 3. As an issue, we believe that in the future we need to compare sleep variables by AiSleep and PSG in healthy people and dementia patients. Thank you for listening. Please use the QR code on the right for comments and questions.